Hello, friends. This is Jessica Keltner, and I wanted to come in and share a little something that's just for the ladies. One of the things I've learned in my many years as a physical therapist is just how many women struggle with what's called stress incontinence. And that doesn't mean that you have trouble with leaking when you're stressed. It means that when you do certain activities like running, jumping, squatting, lifting heavy, things like that, sneezing or coughing, that you sometimes have an episode of incontinence. And here's what I can tell you is that is very common, but just because something is common does not mean that it's normal. And it also doesn't mean that it's something that you have to deal with or put up with. This especially tends to happen to women who are getting a little older, like 30s into their 40s, women who've had babies, and not even with a complicated pregnancy or complicated delivery or surgery, but even just a normal healthy pregnancy can lead to issues with incontinence. The most common reason that women will deal with this type of stress incontinence is because of weakness in their pelvic floor musculature. And again, this is very, very common, but it's also very treatable. And so the reason I wanted to come and share this is that I have some resources that I can share with you if this happens to be an area of concern. And then in addition to these resources, there is an entire specialty of physical therapy of people who treat pelvic floor issues and disorders. And what I will tell you is that these resources can absolutely help and keep you from having issues with incontinence. And if they are not enough, you can go and see one of these practitioners that practices pelvic floor physical therapy. One thing of note is that you do not have to have had something traumatic or have to have had a surgery or something like that to seek treatment for issues with incontinence. Again, it is very, very common, but that does not mean you have to deal with it. And it doesn't mean that it's normal. It actually is not normal. It's something that if with the proper exercises and with the proper training, you can treat it and address it. And so I just wanted to share that. If you have issues or wanted to ask more about that, feel free to reach out to me. I would love to talk to you about it. It doesn't have to be embarrassing. And then if you want me to share some of these resources with you, I'd be happy to do so.